one child should ever die because those bastards closed our hospital.
It's quite frankly tragic what these investors have done.
There's sadness and anger about the loss of this critical community resource.
There's actually a sign up there right in front right now that says emergency department permanently closed. Anyone here with an emergency should call 911.
What you're looking at was one of the busiest hospitals in a county of more than 500,000 people, right outside one of America's biggest cities. Last month, the hospital closed after its parent company went bankrupt. But this wasn't any ordinary bankruptcy.
Moments after Governor Shapiro wrapped up a news conference, a family showed up at the closed hospital saying a baby wasn't breathing.
Prospect never treated us like a hospital. They treated us like a business.
What happened at Crozer-Chester Medical Center in Pennsylvania is happening all across the country. Private equity is buying hospitals, loading them up with debt, and then shutting them down, all while investors cash out.
They don't have any skin in the game. They can take financial risks but not have to pay the price for them.
I hope for you that you never have a hospital close in your county. I hope for you that private equity never comes into your county to take over your health care.
We can't believe that we're not going to be able to help these people anymore. And somebody has to do something because these people deserve it.
Crozer-Chester Medical Center, located in Delaware County, Pennsylvania, was the busiest ER in the area, treating tens of thousands of patients each year. It was the main hospital in a system that, until 2022, was made up of 4 hospitals.
We were a really robust hospital and we were busy all the time. Those people trusted us. They came every day and let us take care of their families.
But in the mid-2010s, the Crozer Health system was in financial trouble.
Crozer was a nonprofit system that was struggling because they're a safety net hospital system. They have a disproportionate number of people who are covered by Medicaid or uninsured. And so these types of hospitals, they often have very thin margins.
So in 2016, Crozer's nonprofit board approved a sale to a California company called Prospect Medical Holdings. Unlike Crozer, Prospect was a for-profit system, and its principal owner was Leonard Green & Partners, a private equity firm based in Los Angeles.
Some of the companies they've owned over the years include Joann's and a number of other just big box stores or chain restaurants.
We were told that Crozer was struggling financially, and so, what were we going to do?
Being bought by a for-profit system didn't fix Crozer's problems. Instead, they got worse. In 2022, Prospect closed 2 of the 4 Delaware County hospitals it owned, and conditions at Peggy's hospital deteriorated.
Pretty quickly, we started to see the supplies change, right? They started using different vendors. The quality was not what it was before, and little by little, we had less and less staff.
Well, hundreds of workers at Crozer Health will soon have to find a new job.
Like all of those support systems that really made us be able to do the great job that we were always to do in caring for our patients, we started to notice all of that start to go away.
So what's the incentive for a private equity company that owns retail stores and restaurants to get in the business of struggling hospitals?
Instead of putting money into these systems, they're actually taking money out of the systems.
In 2018, just 2 years after buying Crozer Health, Prospect took out a $1.1 billion loan and then sent nearly half of it straight to their investors while Crozer continued to suffer.
It's fundamentally extractive. Even among private equity industry folks, it's a controversial way to generate a return on an investment because it adds absolutely no value to the company in question. And the private equity firm is not on the hook for any of that debt, but they can reap the rewards.
Leonard Green sold Prospect in 2019, but Prospect and its hospitals were still on the hook for the debt. In order to pay down that debt, Prospect sold the real estate of its hospitals, including Crozer, to an Alabama company called Medical Properties Trust, or MPT. These deals are known as sale-leaseback transactions.
What MPT does is it partners with health systems like Prospect to buy up their real estate and then rent it back. I like to call it a hospital landlord because that's really what it is. Most of the time, the revenue that's generated from these one-time sales of the real estate, it doesn't go back into the hospital. It's being pocketed by investors.
And like a tenant, Crozer had to start paying rent, $35 million a year. Last year, the Pennsylvania Attorney General's office sued Prospect and Leonard Green for mismanagement and breach of contract, saying the company, quote, broke their promise with years of neglectful, self-serving practices that have put lives at risk. This January, Prospect filed for bankruptcy, and within months, it closed its last hospitals in Delaware County, including the one where Peggy worked.
I'm going to tell you honestly that we all believed, up until that very last day in April, that we would be saved and they would keep Crozer open because of how desperately needed it is in that community. And it was like someone kicked me right in the stomach. I remember feeling this like, how can this end? Nothing will haunt me like those days prior to closing that inpatient psychiatric unit, where I felt like I was herding patients out like cattle, where I felt like nobody cared about them.
On May 15th, the stakes of the closure took a dire turn.
When a woman came in her vehicle, screeching her brakes right behind the press conference, screaming at the crowd for us to help her with her baby who needed care. She took this baby to Crozer not knowing that it was closed.
They just called and said that she wasn't breathing, and my heart just dropped.
She was taken by ambulance to Nemours Children's Hospital in Wilmington, a 20-minute drive away, where she was given a diagnosis.
I have 6 children, and no mother should have to drive up and hope that there's someone there to save their child and frantically hand their baby who's not breathing over to someone to save when there's a hospital right here and it's empty.
What's happened to Crozer is this natural outcome of what happens when we allow markets to dictate access and quality of healthcare. It's not profitable to provide healthcare at a hospital with a disproportionate number of people on Medicaid. And if we don't want that to be the case anymore, we're going to need to find a way to finance healthcare that it doesn't allow investors to swoop in and extract from these systems before they finally go under.
The impact of shutting down Crozer-Chester Medical Center isn't limited to just Chester either. Since the hospital closures, the share of Delaware County residents who live more than 5 miles away from a hospital has nearly tripled. Emergency visits at one Delaware County hospital have increased more than 40%, and local officials have had to scramble to make up the loss of ambulance services Crozer provided to towns and boroughs.
What we are experiencing is the trickle-down effect of the loss of 4 hospitals in Delaware County, a county of over 500,000 people. Longer emergency department wait times, longer wait times for EMS, significant challenges getting appointments.
Minutes matter, whether you're having a stroke or a heart attack or you've been shot or stabbed or you can't breathe.
In June, the Pennsylvania House passed a bill, backed by Governor Josh Shapiro, that would ban sale-leaseback agreements and give the Attorney General new oversight powers over mergers and acquisitions involving hospitals and nursing homes.
Currently, the Attorney General's office finds out about it when we all do. There's provisions to look at it and decide, is this in the public interest?
The bill is now in the Republican-controlled Pennsylvania Senate.
And I hope lawmakers come together, Democrat and Republican, like the group we have assembled here today, and quickly pass this much-needed legislation, put it on my desk, and I will sign it into law.
This year, more than a dozen bills have been filed across 9 states to address private equity in healthcare, including a ban on sale-leaseback transactions in Massachusetts and another restricting the corporatization of healthcare in Oregon. As corporate greed continues to infiltrate healthcare around the country at astonishing levels, we're left asking, how many more communities will pay the ultimate price?
Our health system is like a dangerous, windy road that's been engineered really poorly. And the legislation right now in Pennsylvania, if passed, that would be like putting guardrails up.
I blame private equity. I blame Prospect Medical. I blame Leonard Green. They came to Chester with this one intention in mind, was to take every bit of equity from us and to leave us bankrupt and to walk away.
As for Crozer, House Bill 1460 will be too late, but officials hope the hospital will eventually reopen in some form.
A hospital is where people go for care, and a hospital is where people go to be cured and to be saved. And to think that a company can come in and treat us like any other kind of business that when you're done with us, throw us away. They have left people devastated. People have died. People will continue to die. They sold out this poor community for money. And that's something that I think can never happen again.
Thanks for watching this video, and if you have any ideas for stories involving private equity or healthcare, drop us a line at stories@perfectunion.us. Thanks.